Good afternoon, sir. I'm Angela Nicole Marcos from Wesleyan University, Philippines, a third-year student nurse. So for today, I'll be doing the Administering a large volume cleansing enema. So let's start with the purpose. So for the purpose, first, this is to relieve constipation or fecal impaction. Second is to prevent involuntary escape of fecal material during the surgical procedure. The third one is to promote visualization of intestinal tract during the intestinal exam, and then to establish the regular bowel function during the bowel training program. So let's proceed on the equipment. So we have here the solution as ordered by the physician at 105 to 110 degree Fahrenheit or 40 to 43 degrees Celsius for adult at a prescribed amount. And then we also have here the disposable enema set, which includes the solution container and the tubing. And then we have here the water-soluble lubricant, the IV pole. We also have here the necessary additives as ordered. We have here the waterproof pad, the bath blanket, bath towel, bedpan. We have here the toilet tissue, the disposable gloves. We have the additional PPE as indicated. And then we also have here a paper towel, the washcloth soap, there's a soap, and the towel. So let's proceed on the assessment. So for the assessment first, ask for the last bowel movement of the patient. Assess the abdomen by auscultating, percussing, and palpating. The third one, assess for the rectal area for fissure, hemorrhoid, sores, and tears. And then assess the laboratory works. So let's proceed on the procedure. Okay. So for the procedure, of course, we need to verify order for enema and bring necessary equipment to the bedside stand or the overbed table of the patient. After that, we may now perform hand hygiene. Okay. Perform hand hygiene and then wear PPE as indicated. Okay. Then after that, identify the patient. So, good afternoon, ma'am. I'm Angela, I'm your nurse for today. So, may I know your name? Can I see your wristband? Okay. How about your birthday? Okay, good. So, after identifying the patient, close the bedside curtain or the door of the patient and discuss what you're going to do and then why is it necessary, and then discuss where the patient will defecate. It's either in the bedpan, the commode, or the nearby bathroom that is ready for use. After that, warm solution, check the temperature at amount ordered using the bath thermometer, or if the bath thermometer is not available, warm to room temperature is slightly higher. And then after that, use the inner wrist to test for the water. If the tap water is being used, adjust the temperature as it flows from the faucet. So after that, add enema solution to the container. Okay, reclamp the tube and allow fluid to run through the tube. So I have here the bag. Okay, let's pour some solution. Okay, good. And this one. And then after that, since you already put on the solution, allow fluid to run through the tube before reclamping it. Okay, and then after that, adjust the bed to a comfortable height to work. Okay, adjust the bed to a comfortable height to work. Position the patient in a side-lying position or the Sims position, and then flip the or fold the top linen. Just allow to access the just allow to access the rectal area, and then place the waterproof pad under the patient's hips. Okay, so like this. Okay, like this. And then after that, put the gloves on. So I have here my gloves already. And then after that, elevate solution as it no higher than 18 inches or 45 centimeters above the level of anus, and plan to give the solution slowly for about 5 to 10 minutes. And then hold it on the IV pole or hold it at the proper height. Okay. So after doing that, generously lubricate. Okay, generously lubricate the end of the rectal tube. Okay. So here's the lubricant. Okay. Generously lubricate the rectal end of the rectal tube for about 2 to 3 inches or 5 to 7 centimeters. 5 to 7 centimeters. A disposable enema set. A disposable enema tube have a pre-lubricated rectal tube. And then after that, lift the buttocks of the patient, exposing the rectal area, and then fold the top linen, just allow to access the area, and then slowly and gently insert the tube. Okay, slowly and gently insert the tube for about 3 to 4 inches or 7 to 10 centimeters for adults for adults. Direct to the angle pointing towards the umbilicus, and ask the patient to take several deep breaths. Okay? And then after that, if the resistance met while inserting the tube, permit a small amount of solution to enter it, and then slightly withdraw the tube, and then enter it, and then continue to enter it. Okay? Do not force to entry the rectal tube, and then ask the patient to take several deep breaths. Okay? After doing that, introduce solution slowly for about 5 to 10 minutes. Okay? For about 5 to 10 minutes, and then clamp the tube while the solution is being instilled. And then after that, after solution has been instilled, clamp the tube and then remove it. Slowly remove it, and then ready. Have a paper towel ready. Have a paper towel ready as the tube have been withdrawn. Okay. After that, return the patient. Okay, return the patient in a comfortable position. Okay, like this. Okay. And then after that, instruct the patient to hold the solution until the urge to defecate is strong. This will take for about 5 to 15 minutes, and then make sure that the linen of the patient is dry. Remove the gloves. Okay, remove your gloves, and then make sure that the patient is covered like this. Okay, good. And then after that, raise the side rails. Okay, raise the side rails, and then position the height of the bed in a comfortable position, and then adjust the head of the bed in a comfortable position. After that, remove the additional PPE as indicated and perform hand hygiene. Okay, after doing that, when the patient has a strong urge to defecate, position the patient in a sitting position like this, okay? Position the patient in a sitting position on a bedpan or a commode. So as you can see, we have here the bedpan or the commode, or ask the patient to, or assist the patient to the bathroom, okay? And then after that, give the toilet tissue to the patient if the patient can reach it, okay? So ma'am, here's the tissue. Okay, and then after that, stay with the patient and have a call bell readily accessible. Okay, and then after that, remind the patient not to flush the commode before you inspect for enema, and then after that, I put non-sterile gloves, okay? I have here again the non-sterile gloves. Put non-sterile gloves again, okay? Put non-sterile gloves and assist the patient if necessary while cleaning the rectal area, okay? Over a washcloth and the soap to the patient. Okay, here's the towel. Here's the washcloth with soap, and then after that, offer a towel to the patient. Okay, this is the towel, and then offer a water for hand washing. Then you may now remove your gloves. Okay, remove your gloves, and leave the patient clean and comfortable. Leave the patient clean and comfortable, and then clean properly the materials or the equipment that is being used. Okay. And then after that, perform hand hygiene. Perform hand hygiene and then document all the procedures.